Health for Life. This is the first ever medical show on television that deals with prevalent health problems and concerns, and they do so in an easy to listen to question and answer format. To find out what we're discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
To go see their doctor.
And I think it's important to say again what you mentioned. If during that exam it is extremely painful, then they possibly have some other condition such as hemorrhoids or fissures or something else that the physician will be now interested in figuring out.
That's correct.
Right. This person is asking, a little bit younger than we would expect, but the person is saying they're 27 years old and they're having a majority of the symptoms we've described, the urinary retention, etc. And they want to know, what should they be thinking about? Is this BPH or is it likely to be something else?
So obviously it's very difficult to diagnose this without seeing the patient. Generally speaking, BPH affects men over the age of 50. So immediately if this is somebody in their mid-20s, then it's very unlikely to be BPH. There are other conditions that can present with urinary complaints. And so in this case, I would certainly advise your patient to see their doctor or urologist so they can be investigated properly. Generally speaking, BPH doesn't affect men in their mid-20s.
Yeah. Now let's go and talk about the broad category of complications. So benign prostatic hypertrophy is an enlargement of the prostate gland. Its primary problem it's going to create is an obstruction to flow of urine out. Let's make a list again for viewers of what are all of the complications. And let's take it the next step and say, if these complications are not treated, what happens? So let's make the list of the complications that can occur from just the obstruction being there.
Okay, so it may not be a textbook complication, but one of the immediate problems of a persistent BPH that's very symptomatic is the patient's lifestyle and basically their quality of life is going to be significantly affected, and they're usually very bothered. They're up all night passing urine, they're struggling and straining to pass urine, it's painful, and that in itself can be very difficult to live with. In terms of medical or surgical complications, as you mentioned, the urine doesn't leave the bladder the way it should, and so a lot of the urine is retained in the bladder. And as we can consider it somewhat of a stagnation, and therefore when something is sitting there for longer than it should, it's more susceptible to infection. Okay. And with infections, bladder infections, infection of the urine within the bladder, it can lead to other things such as stone formation. Other complications can be the man being unable to pass urine at all. So wakes up one morning or gets up in the middle of the night and is just unable to pass urine. BPH can sometimes lead to something called hematuria, which is blood in the urine, and sometimes a vessel on top of a very enlarged gland can rupture, and that can bleed as well. And so those are some of the most common complications.
Right. So as you mentioned, you can get the bladder becomes so distended and you're having difficulty passing it. The obstruction is so severe you can't pass at all. You get bleeding, infections, stone formation. Now this is different than the common stones we talked about in the last program, which is kidney stones. These are stones actually forming within the bladder.
That's correct. So these are bladder stones, and they usually form because the urine is not able to be adequately emptied from the bladder, and so infection occurs. Things get deposited, and therefore eventually stones can form.
Now I know when we talk about dialysis or kidney failure, we generally, the large amount of those are from high blood pressure and diabetes. But can benign prostatic hypertrophy and this obstruction lead to failure of the kidneys also?
I don't believe it's very common, but it certainly can. Anything that's obstructing the urine from flowing out of the bladder basically causes a backup, so to speak, of urine. And when urine backs up into the bladder, it can actually exert pressure up the ureters, which then lead to the kidneys. And if the kidneys start to become affected because you're unable to pass urine, then it certainly can lead to damage to the kidneys.
Now, there is a question about BPH and leading to cancer. I think it's very important. This is always a common concern because when you're talking about the prostate and the prostate getting large, it can be from cancer, can be from BPH. Viewers and listeners are always, and our patients always confused. So let's set the record quite straight. BPH, prostatic cancer, two separate entities.
Right. So the first thing to note for your viewers are they're completely separate entities. Benign prostatic hyperplasia, an enlarged prostate, does not lead to prostatic cancer. There are men who can have both conditions that can affect, both prostate cancer and an enlarged prostate can affect the same man. But generally speaking, BPH is a separate entity from prostate cancer.
We'll take this question and then we'll go to a short break. But the question has to do with lowering the risks, a person lowering their risks of development of benign prostatic hypertrophy.
There's no exact answer for that. Yeah. There's not a lot of science and a lot of evidence in terms of pointing persons to the right in the right directions in terms of what they can do to prevent it. We know that as you get older, it's almost automatic that your prostate will enlarge. In terms of preventative measures, general things hold. Decrease your smoking. Make sure that you eat the right things. Make sure that you get exercise. And those are generally things that hold fast for your general health and well-being. And they remain the same for BPH. Nothing specific that's there.
We're going to talk a little bit about the PSA, which stands for prostate-specific antigen. It's a blood test. But I'll just deal with these two questions quickly, which we've dealt before. And there was a question about sexual function, and the answer is directly or indirectly it can affect it. Another person who's asking about having the urge to go to the bathroom and having accidents and do they have BPH. It's one of the things to consider, and that person needs to see their doctor. This question is kind of cute. It says, can an ultrasound replace a digital examination? And I think you'll answer that in a short bit. But
no, it can't. And in fact, ultrasounds can be both transabdominal or transrectal. And ideally speaking, if we're going to examine the prostate, it should be a transrectal ultrasound. So same route, finger might be
slightly smaller than the ultrasound probe. Yeah. Now let's do this. Let's have this discussion on the PSA test, because I think it would be fair to say that almost every patient who comes to you with some of these symptoms has had a PSA test. It's a test that so many persons are having done quite commonly, and we'll get into the controversies. But let's start with what is a PSA test. First of all, it's a blood test.
Right. So it's hard to talk about the blood or speak about the prostate without hearing someone say something about a PSA. And so you mentioned prostate-specific antigen. Prostate glands are found only in males, and PSA is something secreted only by the prostate gland. It can be detected in the blood, and so it's a blood test used to detect this thing called the PSA. As it relates to what we've been speaking about, BPH, it's not directly applicable to the diagnosis or treatment of BPH, but it's more relevant when we speak about prostate cancer. So we can speak a little bit more about that if you wish.
So somebody's going to go see their doctor, or they're going to have these concerns, they're going to get the PSA test. If the test is very high, then that would lead you to be more curious about or more concerned about prostate cancer. But by itself, you're not going to use it in the diagnosis of benign prostatic hypertrophy.
Right, or even in prostate cancer. A PSA result is something that's really tricky and it's really subject to interpretation. Persons with normal prostates without prostate cancer can have an elevated PSA. It can be elevated for various reasons, BPH being one, infection being another. Several things can elevate it. And then there are persons with a normal PSA that actually have prostate cancer. So by itself, it is very subject to interpretation, and it can be very dangerous and misleading in some cases. If your viewers or patients are thinking about PSAs, that's something that they need to discuss with a urologist and be advised on how to move forward. Correct. Not just go to a lab and have a number interpreted.
Yeah. And I think it's very, very important that our viewers and listeners understand that. The PSA test and its recommendations continue to change. Yeah. And I know Dr. Chris Prashad and I are planning on having a talk most likely in the second season on prostatic cancer, and we will deal a lot more, or deal with it in more detail on how the PSA test should be used. Mm-hmm. But I would like to say again what he's just said, that if you're going to have a PSA test, you should have the PSA test after you have seen your urologist. Now let's switch and talk a little bit more about the treatment. We talked about the medical treatments and we talked about the surgical treatment. Let's talk again about the medical treatment. And you did mention some of the alternative therapies like saw palmetto. So let's talk about what are the medical treatments or the alternative treatments, and then how are we measuring success of these treatments?
Okay. Generally, treatments for benign prostatic hyperplasia, two main classes of drugs. There are several, but I'll focus on the two main classes. They're the alpha blockers, which are things like doxazosin, Flomax is a brand name, and then there are 5-alpha reductase inhibitors, which are things like finasteride, Proscar. Generally, what the medication aims to do is to help the patient pass urine more freely by relaxing some of the muscles in the prostatic area as well as in the bladder neck. Okay. And also, some of the medications, they actually work on reducing the size of the prostate. It will never reduce it back to what it was when the person was 20 years old, but it will reduce it by maybe about 20 to 25%. So those are the main mechanisms by which the medication will work. Again, some men do well, others do not, and need to move on to some other form of treatment, which is generally surgery. You mentioned saw palmetto. To recap, and we did cover this somewhat, saw palmetto is a herbal medication, and some persons advocate its use, even in Europe. There's not a lot of strong evidence to support consistently that it will make you better, and so generally speaking, I don't recommend it, and I stick to the more conventional therapies.
Now, let's go back to measuring the success of your medical treatment. Generally, you would have started treatment because somebody has got one or more of these obstructive symptoms. So how long will they have to take it whilst you're measuring success for you to say, hey, it is working, or look, it is not working? What's the time frame?
So it's not exact. It's very individualized. Generally speaking, first the patient needs to meet the criteria to be started on medication or to go directly to surgery. Okay. Let's start with medication first of all, because I believe that's more or less what you're alluding to. If a person is symptomatic enough that we feel that they will benefit from medication, we usually start them on medication, ask them to make a few lifestyle changes. And the first review is sometime between maybe 4 to 6 weeks. It depends. If they respond very well to the medication, we can continue the medication and have further discussions. If they don't, some dose adjustment may be required.
Okay. Now, the medications, if you are going to take this medication to reduce your prostate, is this like a high blood pressure, diabetes medicine, you're taking it for the rest of your life? Or will this medication work and then you can come off of it?
I'm afraid the answer is not that it will work after 2 weeks and you can come off of it. Yeah. Most men that have been started on medication and do well on medication are still asked to take it indefinitely. Okay. I mean, it's quite likely you can be taking it for the rest of your life.
Now let's talk a little bit about, are there patients who absolutely cannot be on some of these medications? Or what are some of the side effects that are so troubling, if there are any?
Some patients can be bothered by the side effects of medication. Side effects can range from dropping your blood pressure, so it makes you very dizzy. Okay. We usually advise that they take the medication when they're going to bed, so they're lying down, so that's less likely that will happen. They can have stuffiness in the nostrils or feel very congested. Headaches, also frequent. Some of the medication can cause a decrease in your libido and sexual function. Those are the most common complications. And of course, if the patient is experiencing these complications, they're always advised to speak with their doctor, and there are dose adjustments alternatives that can be made. And some men even choose, because I mentioned the patient can be asked to continue their medication indefinitely. Some men actually decide that, they would prefer to undergo surgery and be done with having to take these tablets every day, and that's a real option as well.